Going back to school this fall, the debate over whether or not it's safe continues, but there are some things that can be done to try to make sure it's safe for everyone. Dr. Amy Kahn, Executive Medical Director at Regence BlueCross BlueShield of Utah, shares some insight from a recent study by Regence and its parent organization.
Yeah, they reviewed evidence and policies of 7 states and 5 different countries.
Whereas we all continue to learn more about the novel coronavirus that causes COVID-19 and its spread among school-age children, meeting the educational, social, and emotional needs of our kids remains critically important. And we know that many of our parents, community members, teachers, and employers are looking for information, really hungry for guidance on a safer return of children to school.
Dr. Kahn says there were some consistent qualities observed among school systems that were able to successfully reopen, including being flexible, nimble, and creative.
Emerging evidence suggests that making in-person school attendance voluntary is really important. It allows for that individual, whether it be the student or teacher or the families, to assess their own personal risk or vulnerability for infection. What's important is making sure there's assurances if there is distance learning, that there's connectivity, access to, say, mobile hotspots, making sure that there's effective engagement in that learning environment.
She also points out it's important for school policies to be protective, like enforcing hand washing, face coverings, and more.
We also know that adopting these practices at home in our workplace will also help decrease spread to the children or the teachers that are teaching them. And then lastly, probably most importantly, is that each school develops a contingency plan to adapt their teaching methods, especially during surges or outbreaks in a particular area, and then modify their precautions as guided by public health evidence or guidance.
Here is a full list of their recommendations. They include making in-person attendance voluntary, implementing health screenings, use methods that ensure physical distancing, maintain safety practices, and adjust online lessons using tools that engage students. And if you want more on this or any other health stories, or if you have health questions that you'd like answered, Fox 13 and Regence BlueCross BlueShield of Utah would like to hear from you. You can reach us at healthiertogether@fox13now.com.